Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Nigeria records 18 deaths in the last 24 hours as infection toll now crosses 200,000. Edo government denies unvaccinated civil servants access to offices as it begins enforcement of its no COVID-19 vaccination card, no entry policy. And European Union's chief executive warns against a pandemic of the unvaccinated, announces donation of 200 million vaccines to non-EU countries. And Nigeria crossed the 200,000 mark of confirmed COVID-19 cases after the Nigeria Center for Disease Control announced 519 cases on Tuesday. The agency said a backlog of 110 infections and 5 deaths were reported from Ondo State on September 13th and 14th, while 18 persons died of COVID-19 complications. The NCDC data also indicates that 292 people were discharged after recovering from the virus. Here's more on the update.
19 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 14 states and the FCT, indicating an increase from the figures reported earlier. Again, Lagos topped the infection charts with 120 cases. 110 cases were recorded in Ondo. Rivers had 74, Edo had 63, while 58 cases were recorded in the FCT. Oyo recorded 31 cases, Kaduna had 15, South states, including Bayelsa, Cross River and Delta, registered 11 cases each, while Kano, Ogun, Plateau, Adamawa and Gombe states reported single-digit infections. There were 0 cases reported from Ekiti, Nasarawa, Osun and Sokoto states. The latest update also includes a backlog of deaths and discharges from Ondo State for September 13th and 14th. Nigeria now has a total of 200,057 confirmed cases. 292 people have been discharged in the last 24 hours, increasing the total number of recoveries to 188,719. 18 additional deaths from COVID-19 complications were reported in the last 24 hours, raising the fatality toll to 2,637. Over 4 million eligible Nigerians targeted for COVID-19 vaccination have been reached with the first dose, while over 1.6 million persons have been fully vaccinated. In Africa, there are more than 8 million confirmed cases and over 204,000 deaths recorded across countries on the continent. The total global confirmed cases have now surpassed 225 million, while more than 4.6 million deaths have been reported.
And many civil servants in Ondo State were left stranded outside their offices today as the state government begins the enforcement of its no COVID-19 vaccination card, no entry to government offices. A member of the state's COVID-19 response team who was speaking at Government House, Benin City, said there'll be some form of concession being the first day of enforcement.
If you don't get a vaccination card, you won't enter, no matter who you think you are.
Like the saying about charity beginning at home, the enforcement of no COVID-19 vaccination card, no entry to government facilities, begins at the Government House in Benin City, the Ondo State capital.
Thank you, ma'am. Oh, God, don't disturb her now, please. Please, ma'am, welcome home, ma'am. Let's go in. Thank you, ma'am.
Security agents carry out their checks. There are no excuses on their brief. A member of the COVID-19 response, however, believes that the opening day might still offer some grace to workers.
The enforcement essentially started with government institutions today. So if an officer of government had to go back home to get a card and comes late to work today, I'm sure, their directors are going to give them waivers. Even if at the end of the day you are not able to turn up for work today, there's a good explanation for it. I left my card and I had to go back home. It was too late for me to come back.
At the State Secretariat, The head of the enforcement team, Haruna Yusuf, is part of the screening committee.
It's in the office. I left it.
Who will now follow you to the office? We don't have that instruction. Our instruction is stay at the gate. We don't have card. Go home.
Mr. Yusuf insists that this card verification exercise is not a one-off event.
From our action plan, this is our pilot case. We're starting from government facilities. And going forward, we're going to continue to spread. It's not a one-shot exercise.
The Ondo State government insists that the message is clear. Vaccination is not compulsory, but accessing government facilities without being vaccinated would be impossible.
Well, joining us for more from Ondo State is Mr. Kruzo Sage. He's the head risk communication pillar, the Edo COVID-19 response team. He joins us virtually. Thank you for joining us on the program. Tell us why this health pass or ban to the unvaccinated, especially this first phase of enforcement, which applies to state and local government officers.
Thanks for having me. It's no longer news that COVID-19 is ravaging the world, and I dare say Nigeria. In Ondo State, we're having a very, serious taste of this very bitter pill. As I speak with you today, we have lost 54 persons in the current wave of the pandemic. We've had 3 waves so far. We had the first wave, the second wave, and the third wave is what we are on now. And in this third wave, we've lost 54 people already. So, and then the numbers just keep rising. Tomorrow, you're going to hear again that, at least 1 person, 2, 3 person, in some cases, 4 and above. Over the last weekend, we had 16 deaths in Ondo State, 16 deaths from COVID-19. And we had 2 pregnant women who were 28 weeks pregnant, 2 of them among the 16 deaths over the weekend. And if this is not a crisis, then I don't know what is. So that is why we have to step up and, we have to, protect the lives of our people.
Now, as of perhaps 2006 census, Ondo State's population was 3.2 million, which should have way doubled by now. And we also know that Nigeria doesn't have enough vaccines. Ondo State doesn't have enough vaccines. So don't you think what the position the state you're taking is a little premature if there aren't enough vaccines for everyone?
As I speak to you, we have up to 50,000 doses of vaccines that have not been taken. So I don't know why you would say we don't have enough vaccines.
So comparing that to the population, as a matter of fact, but except you're saying that the reason why the government is taking this, if I may. Okay, so you're saying there is vaccine hesitancy then?
Well, you can call it what you want, but you see, we have doses of vaccines that have not been taken. And so we cannot accept the, the statement that, people, they're not. We have enough vaccines because we have some in our kitties that have not been taken by citizens. Until we run out of vaccines, you cannot begin to say that we don't have enough vaccines.
So what about those who feel maybe they have a personal right, not to take the vaccine? Perhaps religious or other reason?
Well, that's fine. I mean, it's not compulsory. However, as long as this third wave rages, then you're going to have to use alternative ways to do, things you're supposed to do in the midst of large crowds and large gatherings. For example, such people are free to work from home. Such people are free to access essential services remotely. But we're not denying their access to, to what they're supposed to be doing. But we're saying, what? As long as the third wave rages, as long as we keep recording large numbers of infection every day, as long as we continue to record a high number of deaths, we cannot have people who are not vaccinated milling around people who are and putting their lives in danger. Because where the right of the person who decides not to take stops, that's where the right of the person who has decided to take and protect himself begins.
So what is the next step for the state government in this vaccination mandate?
We're just going to enforce it. We're making efforts to ensure that we continue to replenish our supplies of vaccines so that at no time will we run out. But we're going to just keep pushing. until we get as many people as possible in the state vaccinated. Our target is 60% of the eligible population. Get them vaccinated so that we can have some sort of herd immunity. As from that time, then we can begin to de-escalate.
Has there perhaps any group, civil society, taking the state government to court on this issue?
Yeah, we saw an order from the court in Port Harcourt. Our lawyers in the state have addressed it, and it's not a problem.
When you say it's not a problem, has the matter been heard, the substance of...
It's an order, so the steps have been taken to vacate that order. It's a court order, so the government's lawyers have taken steps to vacate the order.
Could you tell us a bit more about this particular order, some of the details and what it says?
I don't know what the details are. Essentially, it's just a small group of people who went to court in Port Harcourt to ask for, their fundamental human rights to be upheld. I don't see how the decision we are taking in Ondo State to ensure that we protect our people by ensuring that they take the vaccines. I don't see how that infringes on anybody's fundamental human right. So like I said, our lawyers have taken adequate steps to set those orders aside.
We appreciate your time, Mr. Crusoe Sage, Head Risk Communication Pillar, Ondo State COVID-19 Response Team. Thank you for joining us. We'll continue to follow the developments in Edo.
Thank you for having me. I appreciate it.
Let's go over to Taraba State, where the Primary Healthcare Development Agency says that over 60,000 doses of Moderna COVID-19 vaccine has they've gotten that, and they've vaccinated over 20,000 residents. Well, they're saying this is without side effects to the recipients so far, and the Primary Healthcare Development Agency says rather it is bothered by the increasing spate of non-compliance to the safety measures.
A look at the streets and markets in Taraba State shows the nonchalant attitude of many towards the precautionary measures against COVID-19. The majority of buyers and traders defy safety protocols as they move about without their face masks. This resident believes that vaccination remains an effective strategy to mitigate the spread of the virus, urging the government to increase awareness about the vaccination drive.
This issue of coronavirus is like many people are just taking it for granted. They are not even serious. I don't know whether the problem is from the government. They're supposed to put more effort by enlightening people about taking or danger of not taking the coronavirus vaccine. Because I've been a victim, I always felt sick before. But when I took my first dose and the second one, I think it has been long now, I'm not feeling any sickness in me.
While the state government continues to advocate for an increase in vaccine uptake, it has now involved traditional rulers and religious leaders to push for more advocacy.
I'm not unmindful of the fact that there are issues. There are states that have been flagged up as red zones because of the simple fact that the Delta variant have already started emerging in those states. And with the immigration and migrations that has been taking place between states, between local and what have you, there is every tendency, if care is not taken and if we have not at least adhere to all these protocols, definitely Taraba State could also fall victim. But God forbid, but we continue to educate, inform, and enlighten our people on the importance of all those social distancing protocols for them to comply.
He believes that the state will exhaust the vaccines, given the impressive turnout of residents.
The total number of vaccines we have received, which is 60,040, is going to be divided into two. First half is the first shot for the Moderna, while the remaining first half is for their second shot. And we are good to go, because by implication and by simple arithmetic, we are almost getting there. By the end of today, I think the record will definitely change. We may most likely be able to vaccinate not less than 23 or 24,000 people, which means before the coming week, we'll be able to exhaust the vaccine and, if possible, even request for more vaccines from the national.
Taraba State currently has a total of 1,074 confirmed cases and ranks 9th as it accounts for one of the states with the lowest number of infections in the country.
Still to come on the program, political divide becomes the focal point of how to manage the pandemic in the US. Join us again. Welcome back. Residents of Ondo State have started going to the various health facilities in the state assigned for COVID-19 vaccination. At one of the centers in Akure, the state capital, there was an impressive turnout at the head office of the Ondo State Primary Healthcare Development Agency, showing the absence of hesitancy to the vaccines. While some were there to take the first dose, others completed their second. Some of them also spoke of their experience after taking the shots.
Uptake is gradually gaining momentum across health facilities in Ondo State. At one of the centers in Akure, the state capital, people gather at the center, waiting for their turn to receive either the AstraZeneca or Moderna brands of vaccine. Some residents who've just received theirs share their experience.
I thought it would be very painful, but the reverse was the case. I find it so easy when I took, and it does not pain me at all.
My husband have taken it, nothing. Likewise, my mom. It weeks nobody around me.
The permanent secretary of the State Primary Healthcare Development Agency says he's impressed with the turnout so far. He's advising residents to participate in the exercise before the vaccines are exhausted.
Since we started this exercise, it has been a massive turnout, both at the level of the facility and even at this agency. We have to open this temporary site because this is not supposed to be a site, but because of the large turnout of people, we felt that if we open the site here as well to create an additional avenue for people to get vaccinated, that is why we are here.
The vaccination exercise is still ongoing in other designated health facilities across the 18 local government areas of Ondo State.
Away from Nigeria, the United States has reached another grim milestone in its fight against the COVID-19 pandemic. 1 in 500 Americans have died from the disease since the nation first reported infection. As of Tuesday night, 663,913 people in the U.S. have died of COVID-19, according to Johns Hopkins University data. And according to the U.S. Census Bureau, the U.S. population as of April 2020 was 331.4 million. It's a toll that comes as hospitals in the U.S. struggle to keep up with the volume of patients and more children are grappling with the virus. Meanwhile, political divide becomes the focal point of how to manage the coronavirus pandemic in the U.S. Our Washington correspondent Maria Bird reports.
The coronavirus continues to cause problems in the U.S. as a new variant is ever present. President Biden takes action as the Delta variant spreads quickly.
This is a pandemic of the unvaccinated. This is totally unacceptable. The bottom line, we're going to protect vaccinated workers from unvaccinated coworkers. My message to unvaccinated Americans is this: what more is there to wait for? What more do you need to see? You've been patient, but our patience is wearing thin, and your refusal has cost all of us. So please do the right thing.
Biden's new vaccine intervention for public and private businesses marks a dramatic step. One legal expert says it's within his authority, but has still created immediate pushback, including multiple threats of lawsuits from GOP governors and the Republican National Committee. There are still some states like Nevada that quickly jumped to following CDC guidelines by requiring masks and vaccinations or weekly testing for government employees, teachers, and education staff. CDC states that vaccine mandates will help to reduce the infection rate among children.
Over the past 2 weeks, I've shared with you data from CDC and our public health partners that demonstrate the important role of vaccination in protecting children. Communities with higher vaccination rates have lower reported emergency department visits and hospitalizations for children with COVID-19, even children who cannot be vaccinated themselves. The president's actions to increase vaccinations among teachers and in the community and to financially support schools in upgrading their protections will help keep our children safe and our schools open.
While some states are heeding to CDC recommendations and presidential mandates, other states, like the Florida GOP governor, Ron DeSantis, said that the state will punish county and city governments for requiring their employees to get vaccinated, threatening a $5,000 fine for each violation. The U.S. President Joe Biden has mandated vaccines or weekly COVID tests. Only time will tell as to how Americans shall respond. From Washington, Maria Bird, Channel Television News.
And our Washington correspondent, Maria Bird, joins us right now for more on the situation in the U.S. Hi, Maria. Is it a battle in the U.S. Between the vaccinated and the unvaccinated?
It is definitely a battle. We are definitely in unprecedented times. It is clear that many Americans are not quite comfortable with this vaccine. I mean, we've just seen several celebrities just in the last few days say that there's all types of unfounded scientific evidence that the vaccine can cause harm.
So get vaccinated or get tested weekly. How are Americans reacting to the president's words and position, individuals or companies?
Well, companies are a big concern. This is going to obviously impact their employees, and this could adversely impact their ability to support their consumers and to produce the products that they have set forth. But at the same time, we are seeing that this is actually making some organizations and some government officials especially more comfortable with being able to transition back to a full force workforce and being able to best support the country as a whole.
If the president is being informed by scientists, the CDC, why are states like Florida taking a stand against the vaccine mandates, going against the regulations?
Unfortunately, states like Florida have stuck to, I think, where we were over a year, almost 2 years ago, which was not believing in the pandemic and really focusing on, I think, the base of what the Republican Party became during the Trump administration. And so if you look at the governor, he is definitely staying firm on that message and not actually at all bending toward where the country has seen scientifically it's going.
All right, Maria Bird there with the latest. Thank you. All right. Well, the European Union is to donate another 200 million COVID-19 vaccine doses to low-income countries, more than doubling its present pledge, the bloc's chief said today. The extra doses announced by European Commission President Ursula von der Leyen comes on top of 250 million shots the EU has already promised to give to other countries, particularly the ones in Africa. Here's more on the global update.
The World Health Organization says only about 4 million coronavirus cases were reported globally last week, the first major drop in new infections in more than 2 months. In its weekly updates, the WHO says the highest numbers of new cases were reported from the US, UK, India, Iran, and Turkey. Meanwhile, the highly contagious Delta variant has been reported in 180 countries, with 6 more countries reporting it in the past week. While the global number of deaths decreased to about 62,000, with the sharpest decline in Southeast Asia, Africa recorded a 7% increase. China has imposed lockdowns and expanded mass testing as the latest outbreak in its Fujian province continues to spread. Fujian province reported new local infections for the 5th consecutive day, with 50 cases over the past 24 hours. Some cities have restricted travel as the highly contagious Delta variant spreads through the region.
With the European Green Deal.
In her second State of the Union address, the European Union's chief executive, Ursula von der Leyen, says the pace of vaccination against COVID-19 must be quickened to avert a pandemic of the unvaccinated.
Why we have every reason to be confident. We have no reason to be complacent. Our first and most urgent priority is to speed up global vaccination. With less than 1% of global doses administered in low-income countries, the scale of injustice and the level of urgency is obvious. This is one of the great geopolitical issues in our time. So let's do everything possible that this does not turn into a pandemic of the unvaccinated.
She also vowed to donate another 200 million COVID-19 vaccine jabs to non-EU countries. And finally, Portugal has fully inoculated 80% of its population against the coronavirus, becoming one of the world's most vaccinated nations as authorities gradually drop most COVID-19 restrictions. The southern European nation, which at the start of this year battled what was then the world's worst coronavirus surge, has vaccinated around 8.2 million people out of its population of just over 10 million. Everyone above the age of 12 is eligible to receive the vaccine in Portugal.
From the NCDC, the Delta variant spreads and kills faster. Avoid close contact with anyone showing symptoms of respiratory illness. Continue to take responsibility. You can get a better understanding of the pandemic on our website. It's channelstv.com. You find breaking news and other stories at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Nwaka. Stay healthy.